Well, this is kind of alarming news. In the next 22 minutes, a man out there will be diagnosed with prostate cancer. 10 men die every day in Australia from prostate cancer, and that figure stops you in its tracks a little bit, doesn't it? And it's not just a cancer that older Aussies get. I feel like that's a little bit of a stigma attached to prostate cancer. I'd like to for you to meet our next guest, who at the age of 45, he was diagnosed, but he's certainly not letting his diagnosis keep him down. Neil Dickinson, welcome to the show. Thank you for joining us.
Yeah, please for there. Thank you. Thanks for reaching out.
A prostate cancer diagnosis at the age of 45. Were you feeling unwell?
No, apart from a urine issue, I've tried to sort of put it out there that I suppose I was getting up a few times in the night, and during the day I would say not quite empty my bladder properly. I feel like the valve would shut too early, and then you drink a bit more water or coffee or whatever, then you'd fill back up again, and then you'll just be bursting within like another 20, 25 minutes. So a bit troublesome. So that's what prompted me to sort of see the doctor, along with getting your old free health check. Then I just told him all my symptoms, there and then.
And how are you feeling today?
How am I feeling today? Fine. Say fine. We'll get on to the subject of the long run, the reason why I'm having this phone conversation now. Currently I've gone through all my hormone therapy, radiotherapy and prostatectomy surgery. So I can safely say I'm standing here with an untraceable prostate PSA reading. So, I'm kind of in remission in some respects.
And you'll be okay?
No, I don't know. It's a tough one. I'm 45 now. I don't think I'll make retirement age. That was sort of the nuts and bolts of it all. Sorry, I'm just at Adelaide Airport. I do apologise.
That's okay. That seems to happen a lot these days.
I'm trying to get rid of my mother-in-law back to England. So.
Oh no! Oh dear.
Initially when I first had the consultation, they said, look, 10 years, but then, it's a tough one because I've been diagnosed locally advanced, which meant my prostate had escaped the prostate and was into like the lymph system.
Right.
It hadn't migrated beyond the pelvic area. So there's always positives and there's always new medicines. So who knows? At the minute, I'm going to try and live my life now before retirement age rather than just work myself. Yeah.
Good on you, Neil. And today marks the start of Prostate Cancer Awareness Month. What would you like to share with people? What's your message?
Well, my message is really more to the younger generation. Don't be blasé about it all. Granted, I didn't even know what the word prostate meant or what it was or what it did. Now, and people, you can tell people to like the blue in the face to go and see a GP, get a test, but they won't, because it's not directly affecting them.
Yeah.
So I'm going to sort of say something right now that will make probably people's ears prick up, and you've got to kind of hit people where it hurts. Now, I'm 45. I've now got erectile dysfunction, so my best mate won't stand to attention ever again naturally. So if I can sort of say that is a serious side effect for leaving it too late, then that's probably my best selling point.
Good on you. Tell us about the long run.
Yes. So the long run is a bit, I suppose there's a few over the course of a year, different sort of directions that all cancers and all charities. Sorry, here we go again. do apologise. So the long run is. I guess a different area. So the long run is an organisation for again more awareness, more fundraising, and so back in say June, for example, there was what they call a walk for him, which was 49,000 steps just to mark 49,000 males that will contract sort of prostate cancer throughout the year. Now, the long run is the long run's kind of up my street because I class myself as a bit of more of a long distance runner as opposed to just walking steps.
Yes.
So I thought, and plus it was a bit long later in the year, so I thought, okay, I can recover a little bit from my surgery, and then do the long run, in September when I'm a bit more fitter.
Okay.
So that's pretty much about the long run, and then play on words. The long run means we're kind of in it for the long run.
Yeah, no,
So,
it's good on you for doing it and raising awareness. Thank you for talking to us. We'll let you go and wave your mother-in-law goodbye.
Not a problem. Thank you.
Thank you, Neil, very much for joining us. We've got Anne Savage, CEO of Prostate Cancer Foundation Australia, on the line. And welcome to the program.
Thank you so much, Jade.
Tell us, how many South Aussies will be diagnosed with prostate cancer in a year?
Look, the numbers are high. You know, in Australia, we know that 66 men are diagnosed every single day. It's not a disease that we can afford to ignore or be complacent about. And we're so grateful to get Neil on the line today. He's certainly one of our local heroes. We've got guys like Will McDonald, who is well known and loved in South Australia. Neil, who has been a champion for our awareness campaign for the long run together with Will and others. We've got a really strong movement behind us in South Australia, thousands of men affected and diagnosed in their lifetime, and lots of work to do to make sure that we absolutely do nail this disease and make prostate cancer history.
Prevention is always the best cure. What is your advice to men out there?
Our advice to men is to know their family history, to talk to their GP, and not to be complacent about prostate cancer. Screening for the disease is really simple. It's a blood test. Men have absolutely nothing to be afraid of. But if we detect it at its earliest stage, we absolutely can beat this disease. And I guess I would really love to share the good news with Neil today that we are hoping within a 10-year window, if we can double funding for prostate cancer research in this country, if we can continue to deliver new treatments, new medicines that extend and save lives, we feel confident that we can get Neil to retirement age and beyond that. We're very close. We are very close. 5-year survival at the moment is 95%. We've just got a small gap to cover, and PCFA will be driving that work to try and make sure it happens here in Australia for Australian men, and then for men around the world to benefit.
And catching it quite early, it is very treatable, isn't it?
It is eminently treatable if you grab it before it spreads outside the prostate. That said, there is so much we can do today. There is so much we can do, even when the disease is a little more advanced. We've seen the advent of PSMA PET-CT scanning, precision medicines, PARP inhibitors, these incredible medicines that weren't available even 3 or 5 years ago are making a massive difference today. But we've still got a long way to go in overcoming the misperception, that it's not a young man's disease, that men will die with it, not from it, that it's not as lethal as other cancers. This is a very serious cancer. We absolutely need to throw our weight behind supporting men who've got it, and then boosting awareness and fundraising so that we can absolutely beat it within our lifetime. And PCFA is absolutely 100% committed to getting to zero deaths from prostate cancer.
And
that's our vision.
I've got a message here from Raphael from in Kilkenny. I get checked every 6 months, but recently my PSA was 40-something. Is this cancer? And if so, what are the odds of effective management?
All right. Look, it's really important that, is it Raphael, did you say?
Yes.
Raphael, make sure your GP refers you to a specialist immediately to get that looked at. So a PSA blood test is a risk assessment tool. It needs to be used in combination with other diagnostic tools to confirm a diagnosis of prostate cancer. It could actually be something completely benign, but a PSA of 3 or above is concerning and should always be referred for specialist care. And that, we should not delay those referrals. It's important in any potential diagnosis of cancer or any other illness not to delay action because we know that can impact outcomes. Raphael, go back to your GP, make sure you request a referral through to a specialist and get that looked at. The specialist will know the right thing to do to take care of you.
And thank you so much. And if anyone would like some more information, head to your website. Is that the best place?
Look, absolutely. Call us on 1800 2200 99. Jump onto the longrun.org.au if you want to join Will and Neil for Prostate Cancer Awareness Month, or go to pcfa.org.au. Thanks so much.